My name is Lora Curry, and I'm a resident in Lincoln, Nebraska. I'm looking forward to Medicaid Expansion starting up on October 1st. It's going to allow my college-age son to have some medical coverage. I first found out of Medicaid Expansion when they put Initiative 427 on the ballot a few years back. What that meant to me is that there would be an opportunity to ensure people that were in the so-called gap. Up until this point, individuals that didn't have dependents and weren't aged or blind or disabled weren't able to access Medicaid. And I knew a lot of people who fell into that gap. The first person I kind of just wanted to talk about was my youngest son's father. Suffered from some pervasive mental illness, and in addition dealt with a lot of addictive issues, both drugs and alcohol. He was unable to obtain mental health treatment because he was not disabled or aged or blind, and we were not together as a family, so he wasn't a single parent with dependents. Sometimes I think as a result of that he wasn't able to get the proper care. I think if he would have had proper mental health treatment and would have had a primary care provider, someone that he could see on a regular basis, and most importantly, the right prescriptions and medications, that he may have had an opportunity to live a better life. Sadly, as a result of some of his choices and his disease, he died of a heroin overdose 7 years ago. So he did not have the opportunity to see Medicaid expansion come to fruition in our state. I also am a single parent of 3 boys. I've kind of gone in and out of the gap over the past probably 10 years. It seems like every time I would take a step forward financially, I would lose something as far as coverage. I've had full Medicaid coverage, and then I've been in transitional Medicaid coverage. I was able to obtain federal marketplace coverage at one point because I made enough money, and then I would drop down. So it was kind of up and down. Unfortunately, there were several times where I was making too much money for Medicaid, but not enough for federal marketplace Obamacare. And when I would get ill, I would need to utilize free clinics. We're really fortunate in my community where I live that we do have those things available, but I know that there are a lot of communities that don't, and it's a lot harder to obtain. I first found out about Initiative 427 being put on the ballot at a homeless function. And some young ladies from Nebraska Appleseed Center were going to our capital to a town hall meeting, and I went and I had the opportunity to testify about what it meant for people that I knew and for myself, but overwhelmingly for people that are marginalized and are living in a situation where they don't have the privilege, and I believe it's a privilege, to have health coverage. I know people talk a lot about what life looks like for people who live in poverty and when they wake up in the morning and what they're facing, and they're facing not being able maybe to make their rent or get shoes for their children or feed their family adequately. But I believe that if they have health issues on top of that, chronic illnesses, or even if they just wake up with severe strep throat infection and they can't get well, it makes it a lot more difficult for them to take care of their kids and go to work and try to support their family. So I've always kind of thought that if people don't have to worry about being sick and they have that basic need met, which I think is a human right, to be able to feel well as possible, then it can change everything in their life any given day.